Congresswoman Barbara Lee. I would appreciate a moment of your time to talk about the prevalent issue of maternal mortality in America. My name is Naomi Tesfaye-Johannes, and I attended college at Loyola Marymount University, where I majored in biology. I became interested in health policy and the importance of having health professionals that can work with lawmakers like yourself to promote the health and safety of the public. This led me to apply for my master's, which is where I stand now as an MPH graduate student at the University of San Francisco. In my first semester as a graduate student, I have learned about important policies such as the Affordable Care Act, while also focusing my attention on the issue of maternal mortality in America. I was born and raised in San Leandro, California, and given that you have been the representative of the 13th District for many years now, I have heavily relied on your leadership. The reason I am bringing up the issue of maternal mortality is because the United States is one of 13 countries worldwide where maternal mortality rates are worse than they were 25 years ago. Unfortunately, there are layers to this issue. For example, Black women are dying in childbirth 5 times that of any other ethnic group. Black women die in childbirth at a rate of 22 per 100,000 in the United States. In 2018, the maternal mortality rate was 17.4 maternal deaths per 100,000 births, meaning that 658 women died that year from a pregnancy-related issue. That same year, California had 53 maternal deaths with a maternal mortality rate of 11.7. I would like to present some solutions on how we can improve maternal health. I encourage you to propose a bill to the House of Representatives that will provide funding to the Maternal, Infant, and Early Childhood Home Visiting Program. This will ensure at-risk pregnant women will be provided home visits and screenings for pregnancy-related issues. This program will also ensure that pregnant women that struggle with substance abuse can have professionals provide resources to ensure these women are safe and being treated. I also find it important to promote research studies on how maternal health is being addressed in America. Federal efforts need to be improved to prevent maternal mortality rates from increasing. The United States does not have a comprehensive way of recording maternal death since each state has the choice of how to record data. This has led to complications when attempting to make a national report and has delayed an analysis from being made on the country's maternal death count. States should report data on maternal mortality annually. This will encourage the states to share data within respective areas so that more reports are published on this issue. Funded research can also implement maternal mortality review committees to ensure that maternal mortality cases are being identified and reviewed in a collaboration with hospitals. This new policy would also need to form a national protocol to address pregnancy issues as quickly as possible. It is estimated that 60% of maternal mortalities in the United States could be prevented, and half of the maternal injuries could be reduced or eliminated with better care. These complications can be prevented by planning ahead. Women should be provided high-quality care during the pregnancy and after childbirth. This may include funded health screenings throughout pregnancy, a review of previous pregnancy-related deaths and the cause of complications, and funding for women to be provided with skilled health professionals. 75% of all maternal deaths are caused by severe bleeding, infections, and high blood pressure during pregnancy. These deaths can all be prevented if they are detected early on. Though there are policies on maternal mortality today, one policy will not address the issue as a whole. There are still many solutions that can be proposed. For example, systemic racism in healthcare has been proven to have a negative effect on both the patient and healthcare provider. Implicit bias training should be mandatory to create awareness of implicit bias, learn stereotypes that are automatic. Though it may be unintentional and it can influence behavior and cause a healthcare professional to provide different care based on stereotypes. This is important to prevent maternal mortality since a person's health needs to be addressed as an individual level since their complications can be life-threatening if not treated with attentive care. Implicit bias training will also combat the disparities that minority women face with maternal mortality rates in America. President-elect Kamala Harris reintroduced the Maternal Care Act of 2019, which would create a $25 million program to fight racial bias in maternal health care. This act has not been voted on yet. but I believe a new policy can build on this idea by broadening such training to be completed by all healthcare professionals, since different departments work together to ensure that a monitoring of a pregnant woman's health is being implemented. It is estimated that 60% of maternal mortalities in the United States could be prevented, and half of the maternal injuries could be reduced or eliminated with better care. Black women's risk of maternal mortality have remained higher than white women's risk for the past 6 decades. As a Black woman myself, I fear of carrying a child in America because of the statistics that are weighing so heavily against me. I also know of many Black women that see how racism is being treated in America and question whether they will be provided the same treatment as a white woman to carry out a healthy pregnancy. A NPR podcast titled Lost Mothers, Maternal Mortality in the United States told the story of a California woman that had a health screening during her pregnancy and was diagnosed with placenta accreta. This is a condition that increases the likelihood of a dangerous hemorrhoid during delivery. With her health providers being aware of her condition, the team was prepared if she were to hemorrhage during delivery. This California mother did have a dangerous hemorrhage during delivery. Her delivery team was able to quickly perform an emergency hysterectomy that saved both the mother and her newborn son. I share the story because of the drastic effect this mother's screening had on her ability to perform a healthy delivery. With her complication being detected and known by her health professionals, a plan was made ahead of time in case of this complication occurring. The advancements in technology have allowed for detections like this to prevent mortality. I encourage you to implement these changes in your own district, since a UCSF study found that Bay Area women have higher rates than the national average on many pregnancy complications that can be detected. This also led to Bay Area women having disproportionately longer hospital stays than other women in the state of California. Such efforts need to continue to be funded and researched to ensure that the best care is being provided to patients. Another solution can be having toolkits that contain everything needed to tackle an emergency complication. This can include common medications needed in an emergency or equipment used on the health of the baby and mother. Some hospitals have begun to implement this by having a crash cart. A new policy can make a crash cart mandatory with necessary emergency equipment to treat pregnant women as quickly as possible. Mothers today experience great levels of stress, and these can have negative effects on their pregnancy, which is why I believe there need to be efforts made by government leaders to protect and promote the health of pregnant women in America now more than ever before. Congresswoman Barbara Lee, I urge you to continue to advocate for members of your district, state, and country as a whole to be provided proper care. Your effort of proposing a new policy to combat maternal mortality can contribute to decreasing the number of maternal deaths this country will face. If you have any questions, I will leave all my contact information on this fact sheet here, which summarizes the points I made as well as more information that we have discussed. Thank you very much for your attentive listening and for allowing me this opportunity to speak with you today.